Welcome back to Montreal Connected. Now, with 50 years of service, Dr. David Mulder is a mainstay behind the bench of the Montreal Canadiens. He's seen it all from stitches to surgery. Dr.
Mulder recently won an Award of Merit from the Royal College of Physicians and Surgeons of Canada, and he's considered one of the league's leaders in treating head injuries.
Yeah, and our Coleman got to ask him what's in his head in our next story.
Well, he's a face most Montreal fans would recognize from the Bell Centre, but one you hope to never see on the ice. Longtime physician and chief surgeon of the Montreal Canadiens joins us today, Dr. David Mulder. Thanks for joining us today.
Welcome. I'm glad to be here.
Excellent. So, 50 years with the team. You oversaw 12 championship-winning teams. Give me an idea. What's the proudest moment of your career?
I think probably the proudest moment was the night that Saku Koivu returned to play after battling his illness and chemotherapy, radiotherapy, and then I'll never forget that evening.
Now, we often see athletes as these physical specimens, but you obviously have more of a softer side to them. You see them when they're most vulnerable. What was it like helping Saku through that recovery and his return to the NHL?
Well, it was a real experience. As you know, he returned to training camp and felt a little bit of pain. And we eventually then made a diagnosis, which was very difficult to explain to him and his family. They were all very supportive, and it led to a very extensive program of chemotherapy, radiotherapy. And there were a lot of doubters that he would ever come back, but he's an incredible spirit. And his rehab program was diligent, and he returned to play.
Looking back 50 years, what's been your biggest on-ice challenge? That moment that scared you?
Well, there have probably been several, but maybe the worst one was with Trent McCleary when he got a puck in the throat and had a loss of his airway. And we've now had two of those. Bill Lindsay had a similar episode a year or two later, or 5 years later maybe.
All right, so, I mean, talking about some of these biggest events, most recently, the Max Pacioretty concussion.
Yeah, that was very terrifying because we went out on the ice and he was unconscious and had obviously very serious injuries which required involvement of several specialties, particularly the neurosurgeons.
Now, you were there, I mean, only rows away. What was your first impression, and do you think the NHL is doing enough to sort of prevent concussions these days?
Yeah, I was sitting right behind the bench in the first row, and it happened literally right in front of me, and I could hear it happen, which was sickening. And then we got out on the ice, and the rest is sort of history. He had a severe concussion, a spinal injury, and recovered from both. My feeling is the NHL as a league has been very proactive in this area. They're the first league to establish baseline neuropsychologic testing. They've established criteria for detecting concussions earlier. They've demanded an off-the-bench assessment and interview using a tested form of concussion assessment. So I think they've been very proactive. I would like to see the rules regarding head hits more strictly enforced, and I don't think there's any place for fighting in the NHL.
Well, let's go on that, because concussions still, to me, seem to be very much a mystery. We don't have a great diagnostic tool. We don't have a great way to predict timetable returns. What's the future of medicine for concussions?
Yeah, that's a really good question. And the thing that scares me the most is that we don't have a good measuring device. If someone has a broken leg, I can take an x-ray, see the fracture, and we know what it's going to entail. Now we can have a fairly serious concussion, do all the current testing, and we may find nothing. So we don't have anything that will help us make the diagnosis. We don't have any treatment. The current treatment is rest. And we don't have a good predictive device in terms of return to play. So I think the major advance is going to come in diagnosis. And through the kindness of Max Pacioretty, we've set up a foundation which will bring in a research MRI machine. Hopefully that'll help us advance the science of concussion. That's what's necessary now.
You spoke about Max Pacioretty, Saku Koivu, athletes returning from pretty serious injuries or diseases. Andrei Markov, another name of returning from an Achilles, from an ACL tear. Would it have been possible 40 years ago to see players return this quickly?
I don't think so. I think there have been enormous advances in medicine. I think one of the things that has impressed me the most are the advances in imaging. And if we had an advance in imaging for concussion, it would be much better. But for a knee or a shoulder now, with an MRI, we can make a very specific diagnosis. If you think of Bobby Orr, who had multiple knee surgeries, they were all 6 or 7 inch slashes in front of his knee. Now, most of these things can be dealt with arthroscopically through a small puncture wound, and it has revolutionized the rehabilitation of this kind of injury.
All right, doctor, I'm going to put you on the spot here. 50 years with the Habs, the greatest Canadian you've ever seen.
Jean Beliveau.
Well, there you have it, Jean. The Grow Bill, according to Dr. Dave Mulder. Thank you very much for joining us today.
You're welcome.